Today, we are going to talk about good sleep habits. So, let's get started with introduction to good sleep habits and why they are important. So, when you get good sleep, when you do it right, you barely notice. You function well during the day, you have lots of energy. And when you don't get good sleep, you notice too. It's hard to do anything right. You feel foggy, you feel tired, you probably eat more. So, we're going to talk about ways to improve your sleep habits and good routines and things you can implement into your life to improve your sleep. So, our learning objectives today are understanding the importance of sleep, identifying the connections between poor sleep and disease, and applying a good basic strategy for healthy sleep. So, sleep is really vital. It helps us physically heal. It's our restoration, recovery time from our day. It helps us recover from illness, to deal with stress. It helps to our brain to improve cognition, solve problems, improves your motor skills. So it's just not about getting sleep. It's about how many hours we get and also the quality of sleep that we get. So you may wake up a lot during the night, but feel like you've slept well, but you haven't. You may have a hard time falling asleep. So just kind of think about the things that you experience with sleep as we go through this program. We do have other adrenal and sleep programs courses in our Wellness University, so make sure you check out those as well. So there are a lot of physiological mechanisms that link sleep habits and metabolic health. We know that getting good rest can help prevent chronic diseases as well as improved nutrition, exercise. So, sleep is really a piece of that whole picture that we're looking at when we think about health in general. So, we want to focus on sleep, activity, nutrition. We want to focus on relaxation, doing fun things. So, sleep is just one of those components of overall health. So, inadequate sleep is really associated with higher intake of food, particularly carbohydrates. So, when you don't sleep that well, you may experience some increase in food intake. So, usually up to 300 calories more per sleep or bad sleep night. So, we want to really focus on getting good sleep in order to keep our calorie intake, in particular our carbohydrate intake, normal throughout the day. There's also a link between sleep and obesity. So when we don't get a lot of sleep, we tend to make decisions that aren't as healthy for us that may lead to chronic disease and obesity. So here's a few reasons why sleep might, or lack of sleep, might increase food intake. More time and opportunities for eating. So you're staying up late, you're watching a show, you tend to snack. Psychological distress. You're feeling overwhelmed or feeling stressed from not sleeping. And it's easy to kind of calm yourself with food intake. More energy is needed to sustain extended wakefulness. So, this is what I was talking about with increasing calories when we're tired, particularly carbohydrates. Our brain, when we don't get enough sleep, really wants that energy during the day. So it's telling you something. It's telling you, I want more energy, I want more glucose. And your brain specifically uses glucose for functioning. So we will tend to go towards carbohydrates when we haven't slept as much. And it also can change appetite hormone. So we have ghrelin and leptin. So these can be kind of mixed up, messed up when we don't get enough sleep. All right. So here's some tips for improving sleep health. We want to find a routine. We're going to talk about these specifically. Cut out the late night cardio. Oftentimes, when you exercise too late at night, you get your body energized and your body doesn't go into that kind of relaxation mode. Reduce caffeine and nicotine consumption. As you know, caffeine and nicotine are both stimulants and they can keep you awake at night. Some people can drink caffeine right before they go to bed and they're fine, but it's recommended that if you are sensitive to caffeine, that you should stop around 2 p.m. Alcohol is another one that you want to reduce. Alcohol is something that makes you feel relaxed and sleepy, and it may help you go to sleep, but your sleep cycles, your deep sleep is going to be interrupted with too much alcohol. So eat late at night or eat light at night, not late at night. We want to make sure that we're eating healthy dinners, light things, light snacks, because the heavier, harder to digest foods are going to keep you up at night. So also talk to your doctor about your prescription schedule. There are some medications that may inhibit sleep, so you might want to take those at a different time. Leave time to unwind. You want to make sure that you're turning off devices, turning off TVs, leaving some time to unwind, relax, read a book, do something that doesn't involve a screen right before bedtime. Baths are really good. They help relax you, calm you down, help you to get into that sleep mode. Again, check your devices at the door. We don't want to be on our phones with that blue light being emitted. Also, with computers, same thing. Blue light is being emitted, so that can mess up our circadian rhythms. Get some sun. Our bodies are based around, our sleep cycles are based around light and dark. So we want to get outside, get some sun, and avoid lying in bed for too long. So we don't want to stay in bed when we're trying to sleep and we can't sleep, because then you're going to associate your bed with not being able to sleep. So we're going to go through each of these. So finding a routine, you want to decide on a time that works for you to get into bed or to start brushing your teeth, washing your face, things like that. So if that means setting an alarm on your phone or your watch, just go ahead and do that. That will be a signal to you to start to get ready for bed. Leave electronics alone. Like I said, they're very captivating and stimulating to the brain, as well as the blue light can inhibit sleep. So we want to make sure we leave time, a few hours at least, without phones, devices, iPads, computers, things like that, TV. If you read on a Kindle or an iPad, make sure you get those blue blocker glasses. So those will help with filtering that blue light out. Relaxing unsweetened herbal tea. So if you don't have an issue with getting up and going to the bathroom at night, if you're fine with liquids at night, an herbal tea such as chamomile, valerian root, kava kava, there's a bunch that have kind of a mixture, lavender, of teas. Sleepy time tea would be good. Again, warm baths at night can help drop your core temperature afterwards. So this is very relaxing. Relaxing music, meditation has been very well researched on helping with sleep. And then when you're reading, make sure that the light is not too bright, because we want our melatonin to increase during the night. So melatonin helps us to get into our circadian rhythms and to stimulate that sleep cycle. And then also keep your room between 60 and 70 degrees and dark. So if that means getting blackout shades, go ahead and do that. Anything that you can prep your room to make it feel comfortable. That could be a lavender diffuser. You might need some white noise, just whatever feels good for you to help you create the environment that you need to get good sleep. All right, so cutting out late night cardio. You want to leave intense workouts, even moderately intense workouts, towards the beginning of the day or, afternoon, late afternoon. You want to make sure that you're not exercising at 6 and 7 and 8 o'clock at night, because this is going to interrupt your sleep. If you need to, you can do some yoga before bed. That's good relaxing, and it's definitely not intense. Reduce caffeine and nicotine. So side effects of nicotine are racing heart, increased blood pressure. You might have sleep disturbances, abnormal dreams, irritability, dizziness. So we want to make sure that we're keeping nicotine and caffeine reduced towards the evening times. So alcohol is counterintuitive as far as sleep. Like I said, it can relax you, it sedates you, it makes you feel relaxed, but it actually inhibits your sleep. It decreases the time to fall asleep, but it also suppresses your REM cycle in the first part of the night. So we may have problems with waking up at night. If we drink too much alcohol, we can fall asleep, but then we wake up in the middle of the night and then maybe can't get back to sleep. So make sure that you limit your alcohol, probably nothing past 6 p.m., and try to minimize the amount as well. Eating light at night. So we want to make sure that we're eating things that are nutrient dense, smaller meals, things that don't require a lot of digestion. So you want to, of course, you can eat your dinner, but if you are snacking into the night, make sure that it's something light, something healthy, and we just want to make sure that we're keeping your blood sugar in control. You know, eating light is good for you all around, even for sleep. Talk to your doctor about your medication schedule. So some medications have a positive effect on sleep and some have a negative effect on sleep. So you want to optimize when you're taking your medications in order to increase and optimize your sleep patterns. So we want to leave time to unwind. And this could be a few minutes, this could be an hour. You could do some yoga, music, reading, enjoying your pets. Try not to watch anything too stimulating on TV. We don't want to watch like crazy horror shows or things that are going to stimulate your brain. We want to make sure that we're getting into that nice, relaxing state right before bed. So taking a hot bath about 90 minutes before bed can help you fall asleep more quickly. It changes your body's core temperature so that when you get into bed with a lower temperature, it signals that your body is time to sleep. And you could use some lavender oil. You could do, some sort of relaxing kind of bubble bath if you'd like. But this is definitely something that is something if you don't do, it's a good thing to try to see if it helps you sleep better. All right, so we talked about this, checking your devices at the door. We are very connected to our devices, social media, reading on our devices. So the blue light really affects your brain. So we want to really cut out the phones and the computers and the iPads at least a few hours before bed. They do make blue light blocking glasses. So if you do read on your device, such as an iPad or a Kindle, those would be a good investment for you if you're having problem sleeping. Also, we want to make sure that our phones are on silent mode because when you get those pings, it's kind of a stimulation to your brain. I got a text message, I got an email, a phone call that we should get up and check it. So we want to make sure that we're disconnected from devices at least a couple hours before bed. So getting some sun, this is what we talked about. There's a powerful effect on the circadian clock for getting sun. We want to ensure that we're going into that light dark cycle of the sun. Understand these effects and you can manipulate light exposure to help yourself sleep better at night and be more alert during the day. So get some sun, get out there. It's a good place to exercise if it's warm enough. Get some fresh air and it will help you sleep for sure. So this is something that people do a lot of times. They lay in bed, they can't sleep. If you can't fall asleep within 15 to 20 minutes, you need to get out of bed, move to another place, do something relaxing. Try not to do this TV, cell phones, computers. You want to practice stimulus control. You don't want your bed to become an association with not sleeping. So make sure that you move to a different place if you're unable to sleep. All right, so the challenge for you is to practice the 11 tips for better sleep hygiene. Notice where you do well and where you benefit from little more attention. So we want to focus on the things we do well and then the things that we don't do well and improve those. Don't compromise your sleep for other activities. A lot of times people like to stay up late trying to get things done. But we want to listen to our bodies. We want to make sure that we get enough rest. So when you're feeling tired, maybe write a list of things that you need to do, put it aside, and then move on to your sleep. Don't feel guilty when you need to rest. We are in a do, go culture. So we oftentimes overlook the benefits of sleep and how much we need sleep. So we want to make sure that we're not in this marathon of completing tasks, doing, going, and just realizing that sleep is an essential part of good health. So what's next? We have an Adrenal 202 course to learn more about sleep health. You can also contact your PartnerMD health coach and your doctor to tell them if you want to take your sleep hygiene seriously. So we have coaches that can help work on your sleep. You can also become involved with more of the Well You courses. You can talk to your doctor. We're here to support you. So if you need a health coach or a doctor's appointment, please reach out to us.